Alrighty, good morning still, heading into afternoon. Had a little bit extra time during a holiday, so we are getting some quick content going. So every now and again, like this right hip still kind of acts up. Just general assumption is up between either that hip tendonitis I had a couple years ago and or a possible disc injury that affected this right side. It just kind of annoys me. So here we are, just trying to see if there's something we can do to reliably kind of assess it, treat it, improve it, so on and so forth. So the issue I deal with is primarily like when I go to set up for my deadlift, this right hip, this right pelvis area, right? Front of these hip bones really kind of pinches in. It's kind of annoying. Again, I can get into here just fine. I will say as I'm holding this, I'm getting a little bit of this like tug into my low back that I'm feeling on my right side, but on my left side. Um, if I kind of open up my left side, that symptom seems to fade. So the question we're going to kind of assess is how much of this is a right-sided hip pelvis issue versus a left-sided hip pelvis issue, and we're going to kind of talk about the relative thought process. So, right, if I just go down for like, right, my mobility is decent, right? Standard toe touch. I can keep my knees straight, right? I feel like my back's grounding adequately, so it's not like there's really any compensations there. Um, so the question again is do I have maybe a touch of a pelvic rotation, which kind of hard to assess on myself sometimes, and or do I have like a pelvic in flare slash out flare, or do I have some generalized like muscle imbalance, right? So that's when it comes to some of this pelvic mobility, pelvic correction type stuff, it's like, okay, I do believe it's more of a muscular balance issue than um, your whole pelvis moving. And sure, there is some like kind of maybe semantics discussion of is it the left side versus the right side? Like, okay, my right side is the symptomatic side. So the question is my right side maybe the hypermobile side because my left side's the hypomobile side? So that's kind of what we're going to tease out today. So, um, what I'm first going to check is again just like my general hip extension. So it's tight. I worked out this morning. Right, so I do feel like a nice stretch into this hip flexor. Oh, let's see. We'll use the so boom. So if I pull this back just a smidge. Alright, so this is about where my hoodie pocket kind of blocks my view. If I side bend, I get a little reproduction of low back pain and like kind of this kind of arcing pain. But otherwise, I feel like I'm getting a couple degrees of hip extension and it's not really symptomatic. All right. And if I bring this over, all right. So overall, using these kind of discs for comparison, my hip extension is relatively symmetrical on both sides. Nothing too crazy there. I know what I'm typically symptomatic in is this kind of what we call fader flexion, right? Like this. This is easy. Like if I stabilize my pelvis, I can drop my knee down no problem. I can drop my knee down. Maybe it's a little tighter on that side, all right? So I feel like, right, like I'm not quite as parallel versus this side. Drops it down pretty easily. Right, this one I feels like my right side's I feel like more parallel, whereas this side's a little more elevated. Maybe. Let's keep exploring. So like I said, right, like when I bring up my left leg into this flexed, adducted position, I feel a nice stretch, nothing really going on with the groin area. Whereas in this position, it kind of recreates those groin symptoms. It feels like a good stretch today, which is nice. So, again, relative position, right? I do feel like I'm able to push my right leg down a little more further than I can on my left side. So, we're gonna do some PNF stretching, muscle energy technique, whatever you wanna call it, to kind of explore what's going on. And we'll kind of do an assess, reassess, more so with the kind of hip hinge slash squatting position, toe touch position, not so much as kind of cross leg, because again, you pull anything too far, you're going to reproduce some symptoms. So normally I'm hammering on my right leg. Let's beat up on the left leg a little bit. So, right, so I'm going to stabilize my right side as best I can. I'm going to gently try and lift up my left knee up into my handle for a few seconds. Let it drop. Oh, that doesn't feel like it's working at all. So, what's the weight on this? That's still too much. We're going to switch to a kettlebell. Alright, so again, it's dropping into a good stretch. 6, 5, 4, 1, relax. So we're just going to hold that there for a bit. And like I said, we're just kind of seeing what's going to happen between the two sides. Okay, so again, I'm kind of lifting up into the weight after about a 30-second stretch, holding it for about 6 to 10 seconds. Trying to feel that inner thigh working. All right, and then from there, right, it's generally easier to drop the leg down further. So in order to extend my hip, I need to be able to go into relative internal rotation. Now let's lift up this side again. So there's two thoughts. My internal rotators are weak, or my external rotators are kind of too strong, or they're in spasm. Or like again, my internal rotators are lengthened and slash weak, or my external rotators are shortened slash too strong, too weak, and they're preventing me from being able to get into internal rotation. So it's not that I'm totally apathetic to like which one's which, but generally working on both is better than just like guessing, right? Your hip external rotators are important to kind of for your general, like they're both important things to have. So trying to only pick on one doesn't really make a whole lot of sense. All right. So So let's see here. So again, definitely feeling a deeper groin stretch on the left than the right when I get myself into this position. Trying to keep my pelvis stable with my hands. That's about it for my left leg. So maybe it's still a little higher. But let's see here. Let's see if that changed anything for us in terms of getting into this deadlift position. No. So with the Faber test being relatively negative on the the Faber being relatively negative on the left and the Faber having some positivity on the right. Let's take a look at that. So this is where, again, I'm going to try and keep my pelvis as stable as best I can. I'm getting a slight there we go. So I'm having to kind of stabilize my pelvis while I get a stretch on my right side. So I'm not doing much. So I'm going to end up pushing my knee diagonally away from me, gently. Right? So now I'm able to bring up my knee a little higher without cheating from my pelvis. We're kind of like side bending into a weird position. So the assumption may be that I have had a out flare or that my hip external rotators are not cooperating. All right, so again, I push down gently. So what I had started to do was to kind of push with my groin, and it's like, no, that's not what I wanted. So I had to kind of reduce the force I was putting into my right hand, just so I'm not aggravating anything from the groin. So again, trying to relax and keep my pelvis stable so that my hip external rotators can do what they need to do. Nope. All right, so that's where again, right, I kind of started feeling like my groin was starting to do too much work. So I had to reset. Oh, there you go. All right. Could I possibly do a few more? Sure, but let's see what that feels like just from a few repetitions, and that may lead us into a So it does feel different. We're gonna bring over this 30-pound loop. So this is gonna be a 3-way bent knee fallout. Do a little figure 8 motion. Oh, what am I trying to do here? Too much coffee and not enough brains. Alright, so we're gonna see if this is 1, comfortable, 2, gives us the tension that we need. I will say relatively yes. Okay, so trying to brace my core, and then I'm going to let both knees push out. So I feel my core working, feel my glutes working, get a little groin stretch. Couple of breaths, come in. Can I tighten this up any further? I think I can. Alrighty. Alrighty. Okay. So that was 1 round where, again, we're focusing good core tension. Driving those knees apart to feel a good glute stretch, or not glute stretch, but like good glute contraction. Maybe a little bit of a stretch in the groin. And then we do the same thing with 1 leg moving, 1 leg trying to be a stabilizer, and then we switch. This is really burning up that right glute. And each time I'm trying to not just hold my breath, but hold that brace. Breathe in 2 to 3 times. Right, good brace. I am trying to keep my feet flat on the ground because that's kind of the squatting, deadlifting position as opposed to just letting my feet roll out. And I am allowing myself to reset between each rep. All right, I'm going to do at least 1 more round. Flat back, core tense. Flat back. Really burning up that right glute, my goodness. All right, last rep. So just off of that, we're gonna go off of feel, but the general thought is like, yeah, like that was a lot of work, and that I might end up implementing some band work in with my uh, movements here to kind of really make sure I get a good burn on that outer glute particularly. So from here, it's still a little crowded feeling, so let's give it a quick check here for the front of the hip quad area. Nothing that's making me particularly jump so far. Alright, so if we come up just a smidge higher. Again, nothing that's like making me hiss or like hate life right now. No, it feels pretty good. Let's check the oh yeah, that's some stuff. Oh, that's awful. So like everything was like, oh yeah, that's uncomfortable. That's whatever. But this is the first spot where I'm feeling like some symptom referral. So like this feels like it's kind of wrapping up underneath my like hip joint a little bit. Oh, that is some stuff. So I do have a stim unit that I might end up using just for some pain relief or just symptom relief, muscle relaxation as I'm going throughout the day. But just off of that, a little bit of self-treatment. Yeah, that already feels better on my kind of that sensation in my hip. So if anything, I should have done this all backwards, where done some soft tissue work and then followed it up with a little more stabilization work after that. Let's see what we got in the back of the glute. Let's see how much we're gonna end up. Oh, let's see here. So that's tender-ish, but when in doubt, check here. So I would say it feels more like a firm pressure on my left side, whereas if I kind of go to the same relative spot on my right, it kind of takes my breath away a little bit. There it is. Whoo, that is So going back to this whole discussion of like internal versus external rotators, my internal rotators felt tender, might have been tight, and currently I believe I'm on more of my like external rotator group. So is one more to blame than the other? Not entirely sure. So working on both isn't a bad thing. All right, so now it's like I've caught my breath. I'm gonna go out along this line here. And that is all awful. Again, awful in the way it's like that is more than just a firm pressure. It's definitely tender. Um, that if I like accidentally kind of sat down on something, it's like I'd want to stand back up immediately. But all right, and now that I've like accommodated to it, my body's kind of naturally sinking in. It's relaxing, and now it just feels like a firm pressure as opposed to like kind of my brain going like, "Are you sure you want to be? Are you sure you want to keep sitting on this?" So, alrighty. So just off a little soft tissue work. Let's see what we got now. Much better. So if anything, out of however long this video was, me working on these lower hip external rotators was my bigger issue. So possibly, mentally in my head, it's like, okay, my hip external rotators are kind of weak and tight, or something's amiss. And that, hey, my hip external rotators aren't working as well as they could be, or dysfunctional, right? That's going to impact how my hip internal rotators work. So just off of a little bit of tennis ball sitting, all this feels better. So again, I would have reversed it. I should have done some soft tissue followed up by stabilization, but this video is long enough. So I shall do some cleanup work on my own end. Yeah, we got time. All right, so what I'm gonna work into is a bent knee side plank into a squat. So I'm having to abduct / externally rotate my thigh into the floor, and then from there squat back without touching the ground to kind of work these internal rotators. So right from here, all right, that's easy peasy. 10, 9, 7, 6, 3, 2, 1. And then if I sit back, 10, 6, 5, 3, 2, 1. And then I bring it back up. 4. All right, and then I reset. What I might do for myself is make this a kind of a 5 second, 5 box setup here. So I'm in my squatting / deadlifting position. 1, 2, 3, 5. And then I hold this for 5, 3, 2, 1. And then I push forward. 2, 3, 4, 5. 1, 3, 4, 5. 1, 3, 4, 5. 1, 4, 5. Whew. So again, it's a lot of work. It's a lot of emphasis on slow control, being stable within each movement, not just each position. Like I can just rocket my hip off the ground, but that's not the intent that I'm looking for. All right, one more rep. All right, so in this kind of squatted back position, 1, 2, 4, 5. about 3 reps. Could I do more? Sure. But this video is long enough already. Alright, so from here, that feels pretty good. Right? Not so much that pinching, no reproduction of symptoms on this side. So, in summary, do a little soft tissue work, try and find those tender spots, test, retest, and then try some of these motions. See what tickles your fancy the most in terms of improving your kind of issues like I did today. All right, if you did what I did today, great. You did your own thing, great. You're just starting, looking for ideas, motivation, discipline, or community to support you. It's what we're here to do, help each other be a little better every day. So, good job today, keep working hard, and we'll see you next time.